The superficial backline. Superficial backline is one myofascial continuity from the bottom of the toes to the back of the head. It starts with the plantar fascia and the short toe flexors, continues around the heel and onto the Achilles tendon, which splits out into the gastrocnemius and soleus muscles, which are interlocked with the hamstrings at the knee and pass over the posterior side of the ischial tuberosity onto the sacrotuberous ligament and then onto the sacral fascia, which is the basis for the entire erector spinae complex and the multifidus underneath, going up to the neck extensors and the suboccipital muscles beneath these extensors, and onto the epicranial fascia. The finish of the line goes over the top of the skull and attaches to the frontal brow ridge. The superficial back line has a strong postural function. You cannot develop from lying on your back to lying on your stomach to sitting to progressively standing and walking without the superficial back line being constantly engaged and in a coordinated way. If you were to contract the entire superficial back line, you'd go into a back bend. A forward bend stretches it, and it is all extensors except for the genetic flexion at the knee. This is the